Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just tuning in through iHeartRadio and Amazon Music Podcasts, we're glad you all could be with us as well. Well, when we're talking about the COVID vaccines, there's still a lot of distrust, unfortunately, and misinformation out there that's keeping some groups from actually getting the vaccine and helping us as we're trying to do all we can to be able to save lives. We're excited to welcome Dr. Linda Bradley to our program today to hopefully to dispel some of the myths that are out there, but also share with you all the importance of not only rolling up your sleeves and doing your part. Dr. Bradley, thank you so much for the time. Really appreciate it.
I'm happy to be with you this morning.
Well, I'm excited to say I got my second dose of the Pfizer vaccine last week. My whole family now is fully vaccinated. Unfortunately, though, especially in minority groups and even to some individuals we're seeing, Dr. Bradley, they're still kind of hesitant to be able to get the vaccine because of some of the information that's out there. What is some of the disinformation that you've been seeing, Dr. Bradley, that is keeping people from getting the vaccine?
Well, I think there are two factors, Cyrus. I think one is probably, I would say, some of it's not really hesitancy per se, not reluctant, but some of it is what's happening in our community. We know that, how did you and your family sign up for this? You know, you don't call an 800 number in general. You need Internet access, and we know that in black and brown communities that's more difficult. We know that there may be a lack of investment in resources within the community, such as local grocery stores and in drugstores, where in wealthier white communities people can go where the vaccines were sent. I think people are also, many are essential workers, and they're concerned about either how far they have to drive to get to a place or that they're going to have to take off a half a day of work. And they're concerned if they have a minor side effect, will they then on the second vaccine lose work time and therefore they can't, if they're not working, they're not getting paid. So I think those are some of the things. I mean, and then there's some of the tall tales that people hear. Patients have said, am I going to grow an extra eye in the middle, an extra ear? So they think, I'm just going to tell you, I'm an OBGYN. What do they say? I'm not going to be able to get pregnant. That's not true. We are giving the vaccine to women who want to be moms, who are pregnant, who are breastfeeding, who just had a kid. Okay, so that's those kinds of things. It's going to affect, like I said, my fertility. That's not true. My husband's a physician. The guys are, it's going to make me impotent. That's not true. Smoking, drinking, and getting overweight are the things that are make you have these problems. They think that it's going to track their movements, that there's a microchip in there. So there's a lot of different things that are there. And then, unfortunately, Cyrus, people go back. You're in the South. The Tuskegee, which was a horrible study where men were withheld treatment. They had syphilis. They didn't get penicillin that was available. They were just watched till they died. This is a prevention. It's a vaccine that prevents diseases. And right now, if people just switch it and say, what other diseases did my great-great-grandmother and grandfather suffer from that we don't have anymore? Things that doctors today, if somebody walked in with polio, nobody would recognize it. None of the pediatricians recognize chickenpox, measles, mumps. I'm a OBGYN. Cervical cancer because of HPV vaccine should be a thing of the past. And so, meningitis, all those kinds of things. There have been vaccines that have changed lives and extended our lives. And so I just think people have to be, we have a relationship problem, meaning the relationship to doctors and hospitals, and not so much on misinformation. It's how people feel that they might be treated by physicians and healthcare workers. And so I think that is, misinformation is a symptom and not the cause. I think people do have to put up with trust because this is a trusted vaccine, very much well done in terms of the science.
And Dr. Bradley, you bring up a really good point about looking at the other side of it. Your part, as well as a lot of other medical professionals, of the Get the Vaccine to Save Lives campaign. So I want to talk about the benefits then. What are the benefits for our audience to go and make sure that they get the vaccine?
Hey, if they can take away 3 things, okay? We're always taught to tell people no more than 7 things. 3 things that benefit you, that you've done, Cyrus, and your family. 1 is if you're vaccinated, you're unlikely to die of COVID. Number 2, you're unlikely to be admitted to the hospital. Number 3, you're unlikely to go to an ICU. And then if I add 4, you're unlikely to have a breathing tube or be intubated. An example, just last week, our hospital, the Cleveland Clinic, which takes care of 25% of individuals in the state of Ohio that has this vaccine, have looked at the admissions from January through end of April. Over 5,700 people admitted to the hospital. They went back and looked at records and say, of the 5,700, how many of them have been vaccinated? Only 10 people that were admitted were vaccinated. So it means that 99% of people, right now, as I look across our beautiful campus, 99% of people, more than 99, I think they said 99.9, that are in the hospital, struggling to breathe, admitted, IVs everywhere, have never been vaccinated. So to me, the power of looking at the people who are currently here, going back, flipping through their charts, and, well, now we don't call them charts, but our electronic medical records, only 10 out of 5,700 have got the vaccine. So to me, there's nothing in life that's 100%, but those numbers look good to me, and that's why my family, like yours, Cyrus, and my mother, who's 90, got vaccinated, and my kids, and my husband, and my friends. So that's the number. Less likely to get all of these horrible outcomes. And we also know that if you get COVID, yes, you get out of the hospital. We know about the long haulers, people that have brain fog, still don't feel well, unusual aches and pains. This is not like the flu and sniffles for some people. And so It's important not to acquire it. And then we get back to our lives, travel, vacation, summer things, picnics, barbecues, ready for the holidays. It just gets you back to doing the kinds of things that we did in our pre-COVID routines, and we can gather safely. And to me, that's the beauty of this and the power of vaccination. As I said before, vaccines don't prevent COVID, but vaccinations do.
And I think that's why this is so important, and we're glad you could be a part of this conversation. Again, everyone, Dr. Linda Bradley has been our guest. Dr. Bradley, where can our audience go to get more information about the COVID-19 vaccines?
Yes, they can go to vaccines. There's a CDC website, vaccines, VACCINES.gov. That's the CDC website. And as our campaign, it's our, O-U-R, SHOT, S-H-O-T, the number 2, SAVE, S-A-V-E, lives, L-I-V-E-S.org. So vaccines.gov and our SHOT 2, SaveLives.org.
All right. Dr. Bradley, thank you so much again for the time. Really appreciate it, and looking forward to having you back on the program again.
Oh, okay. Don't procrastinate, guys. Vaccinate.
There you go. And we definitely encourage our audience to do that. As I mentioned, I got my second Pfizer shot. My parents both got Moderna, and so glad that they have done their part, and definitely invite you guys to do yours. And we thank you all for tuning into this episode of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.